Hello. Hello, Pravinji. Am I audible?
Yes, sir.
Okay, I'll start. I'll share my screen. Hello, everyone. A very good afternoon.
Good afternoon.
Today, I will be facilitating the module 7, that is data collection part 1. First, I would like to introduce myself. My name is Angom Peter Singh, and I'm working as a monitoring and evaluation officer for Northeast iTech India. So today, we will be discussing what is data and what is data collection and high quality data and methods of data collection. And I hope at the end of this session, we will be able to understand it. So let us begin with what we actually mean by data. Data, very simply, is just an information. Data can be quantitative or qualitative, while quantitative data are expressed as numbers and can be measured or counted. Qualitative data are descriptive and usually represented by text. For example, we might use quantitative data to summarize, there are 2 broken computers in the room, and qualitative data to describe that we can use the laptop computers do not turn on and the monitors are cracked. Quantitative data are commonly used to numerically summarize all the available data to give programs a quick snapshot of the program and identify the patterns. And also quantitative data can also be used to make generalization or prediction about a population. For example, we used to report quantitative data like 1,000 PLHIV were dispensed ART from the facility site in the reporting month. It's an example. Qualitative data are used to describe individual experiences, relationships, group norms, and contextual factors. For example, PLHIV has been drastically reduced to come to ART center to collect pills due to the prevailing COVID situation, such as lockdowns, curfews, etc., which is happening right now all over the world. So it can be a kind of qualitative data that we can report along with the quantitative data. So monitoring and evaluation people both uses quantitative and qualitative data to measure program progress and effectiveness, and also able to understand and describe the experience represented by this measure, like I already mentioned before in the last 2 slides. Now that I think we have defined data, so now let's define what data collection is. Data collection is the process of gathering data in a systematic way. Data collection is very important in program monitoring and evaluation because it allows us to systematically gather data that informs data-driven decisions about the program. There are many different data collection methods, as you can see in this diagram. Some methods only collect quantitative data, and some only qualitative, and others can collect both a mix of quantitative and qualitative data. Some of these methods like data abstraction and document review involves collecting data from already available data source, such as program reports, patient charts, national policy documents. Example, we used to collect data from facility centers like monthly progress report, or line list, or viral load list, or CD4 list, etc. And some methods like observations involve collecting new data by observing and systematically measuring and describing behaviors, events, and objects of interest. Example, when we visit a facility center, we can observe that whether there are enough space for clients to sit and wait for their turns to collect the PID, or whether the counseling room is well set up, like kind of things, or whether the staff are treating the client in a friendly manner. Those kind of things we can collect data in such a way with this observation method. And some observation methods like surveys, interviews, and focus group discussion involves collecting new data directly from selected evaluated participants, either in person or either by phone or by mail. And here are some differences while collecting data, comparing with quantitative and qualitative data collection tools. In quantitative data collection, we always use structured tools that remain unchanged throughout the data collection process. And usually we used to ask questions like yes or no, how many numbers, what is the age, agreed, disagreed, fully agreed, partly agreed, like those kind of things. Whereas in qualitative data collection, tools can be more flexible than quantitative data collection tools. And qualitative methods actually rely on open-ended questions that allow the participants to respond freely in their own words rather than selecting from a list of options. For example, you can ask the patient, please describe your experience at the clinic today. That will surely allow a person to respond in many different ways and is an example of a question that elicits qualitative data. Additionally, when you ask questions, may not always be asked in the same or exact way or in the same order. That will totally depend on how the participant responds and can affect how and which questions the data collector should ask next. So, data collection now, is there any question? Okay. So, data collection can be one of the most time-consuming and expensive parts of program monitoring and evaluation. It is very important to collect high-quality data in an ethical way to ensure that collected data will be useful in informing program decision. What is considered high-quality data? We'll discuss now. There are 4 main characteristics of high-quality data that are: first, valid data, accurate data, reliable data, and complete data. So as we are familiar with these 4 characteristics, as an MNEGH person or as a program person, when we develop indicators, it should have some of these characteristics, because indicators and data are very much related, because indicators signal the type of data that we require or that we need to be collected to inform progress toward the program objective. So characteristics of high quality data will define: first, valid data. What is valid data? Valid data is data that measures or describes what it intends to measure or describe. In other words, the data means what it is supposed to mean. For an example, if you want to know a person's weight, it should be the weight only, not others. That is called valid data. Next, accurate data. So accurate data, accurate quantitative data is correct data or a correct representation of the reality. For example, let's take an example of pill HIV adherence on taking pills. It is simply, that many of the ART centers simply counted in 30 days, which is inaccurate. It should be calculated based on the number of days the patient came to this facility center after the last dispensation, how many pills left currently, and how many pills was with the patient before, and how many pills was actually dispensed. So this is how we calculate the adherence of a pill HIV. So in such a way, if we calculate, that is the accurate data. So if we miss all those things, then only it will become inaccurate data. Next is reliable data. Reliable data is consistent data. That is, you should have confidence that you would get similar results if you repeated the same data collection process again and again. For example, if you go to a facility center and ask two different staff, I should say, what is the source of a particular indicator of a particular report? And if the response is same, then we can consider that the data that we receive is reliable. Otherwise, it is not. If for example, if we ask the counselor, what is the source of getting indicator of treatment new in the reporting month? And if the counselor replies that the source is from the register, and another staff respond like it is from the visiting register, then it doesn't become a reliable data. So that is how it should be. Next is complete data. Complete data is when a full data set contains all the needed data without any missing data, because incomplete data can lead you to make incorrect conclusion. For example, all the indicators needs to be filled, not only filled, but also needs to update on regular basis. Because if it is not updated on a regular basis, it can also give you incorrect conclusion. For example, in the master line list of ART centers, if the current month visit and the due date for next visit is not updated, then the status of that particular patient can be changed. It can give wrong status. So that is why it is always mandatory to update on a regular basis to make that data a complete data. So as we have discussed high quality data, now we will discuss on preparing of data collection, how we are going to collect the data. Preparing for data collection, well planning supports the development of a valid and reliable data collection and ensures that data collectors are well trained to use the data collection tool. And there are 4 major steps of preparing for data collection. Number 1, develop a data collection plan. Secondly, develop and pilot test the data collection tool that we develop. Third, develop a data collection protocol. And last, select the data collection team and train them accordingly. A data collection plan outlines all the operational aspects of the data collection process, including who will be involved, what will occur, when it will be occur, and where it will occur. Here is an example of data collection plan template. It outlines the dates that data collection activities will occur and what will occur on those dates. Example, of data collection activities include training of data collectors, a data collection pilot to test the data collection tool and processes, a pilot debrief to finalize the data collection tool, and processes, time to travel to data collection facilities, and time to collect the data at those sites. And it also includes those names who will be on the data collection team are also included in the above second rows. So develop and pilot the data collection tool. So it is very important when we develop a data collection tool, we should always keep in mind that it should be aligned with the evaluation objectives, and it should give the accurate answer to the evaluation questions. And we should always collect valid, accurate, reliable, and complete data. And while completing the preparation of data collection tool, it is also very important to pilot testing the tool. When we do the pilot testing, it will involve trying out the tool to identify if there are any aspects of the tool that could be improved, such as the language use or the order and style of questions. Develop a data collection protocol. A protocol is a standard set of rules and regulations which is to be followed while carrying out the activities. The purpose of the data collection protocol is to ensure smooth collection of high quality data that will include defining clearly the roles and responsibilities of the team and how to complete the data collection tools correctly, definitions of the terminology that is being used in the tool, and assure the quality of data, and then regular check-in calls with data collection team members to discuss and questions or issues about the data collection tool and process is also common practice to assure collection of high quality data. So as we plan our data collection methods, we will consider who will collect the data and how many data collectors we will be required for each method and what kind of training and experience they should have. So in the training of data collectors that we selected and we provide training to them, these few points should always cover. That is evaluation objectives and questions, roles and responsibilities of each team member, the ethical code of conduct and informed consent forms, review of the data collection tools following the data collection protocol, and relevant data collection techniques such as qualitative data elicitation techniques for interviews and for focus group discussion. Now we'll go to one of the data collection method, which is called document review. Document review is a way of systematically collecting data by reviewing existing documents. The data can be funding proposal, program reports, meeting minutes, emails, newspaper articles, government policies, or documents, or any documents with text or images and which is useful in answering your evaluation questions can be reviewed. How to conduct a document review? So if you plan to conduct a document review, first you have to decide on a systematic way of selecting the documents. What are the documents that you will be requiring that will include in your evaluation that is totally based on your evaluation questions. Inclusion and exclusion criteria. When you decide what to include, it can be participant of the evaluation or it can be documents. So after you decided that, you have to determine whether you can review all the documents that meets your inclusion criteria, or you can select a sample from the population or documents. So what will be your inclusion criteria? Here is your inclusion criteria. Who developed the document? When the document was developed? Whether the document that was developed was discussed on specific health topic or geographic region. When it is useful to conduct a document review? Document review is a great data collection method. If you are trying to gather background information of a program, document reviews can provide information about the goals and objectives of the programs, its history and evolution, and its major activities. And relatedly, reviewing program documents such as the program proposal, planning minutes, and an early draft of the MNEGH plan can reveal the differences between what was initially planned and what is actually occurring now. These are some of the benefits, or we should say advantages of document review, because its advantage is that it is an already existing data, and therefore it is typically inexpensive because we don't need to go to anywhere as the data is already with us. And another advantage is that there is no data collection burden on others because document review is inobtrusive. It is typically has fewer potential ethical challenges as compared to other data collection methods. And this is the disadvantage of document review, because you may not always find the information you need to answer to your evaluation questions. That is why sometimes document review needs to be conducted, often done in combination with other data collection methods as mentioned earlier, such as surveys, interviews, or focus group discussions. So this is one of the great disadvantages of document review. When the data that you require most is not with you, then definitely you have to go with the other data collection methods, such as I already mentioned, surveys, interviews, or focus group discussions. So now let us go with the last methodology of data collection. That is data abstraction. What is data abstraction? Data abstraction means collecting quantitative data from pre-existing data sources. Data sources can be electronic form, such as IMS, integrated management system, or it can be paper-based, like patient chart, patient health cards, facility registry, and facility logbooks. Electronic data. Let us discuss about the electronic data. The data set is requested from the organization who owns the data. Like we used to collect information or any kind of data that is required from the facility centers who owns the data. Like collecting viral load line lists, CD4 lists, number of people who were newly initiated on ART, those kind of things that I have already mentioned in the earlier slides. Or another thing can be a file with data is shared or access to the database is granted. Like if it is agreed, you know that I already mentioned about the electronic data IMS. If it is agreed between the two groups The IMS login credentials can be shared and the another person can be accessed the database. So this is also another option. And if we talk about paper-based data, in paper-based data, it cannot be shared over internet, over email. So data collectors typically go to where the paper-based data is stored and document what the paper-based data says. This documentation can be done on a paper data collection tool or an electronic data collection tool on a mobile phone, tablet, or computer. For example, when you go to the facility centers and if you want to collect the viral load test results, nowadays it is being updated in the electronic data form, but previously it comes in the paper format. The results comes in the paper format base. So when you go to the facility centers, you can either collect it and type it in your computer, or whether you can just click a picture with your mobile phone and then come back and convert it into electronic form of data. That is happening like that. Advantages and disadvantages of data abstraction. One of the benefits, some benefits of data abstraction, it is an already existing data. That is why it is inexpensive. Means data collectors doesn't need to go here and there, and easy to collect the data. And there are some limitation in the data abstraction. The exact data that you need or you require may not be available in the pre-existing data source. And another one big difficulty is getting permission to access the data can sometimes be really difficult. It can require, multiple attempts to identify the person who can grant you to access the data. And sometimes responses to requests can take a very, very long time. Example, getting required data in some places from facility required permission from various lines of stakeholders. We have to write a mail asking for permission. Then again, that person will write a mail to his boss or her boss. Like, for example, in Northeast, we used to write a mail seeking permission from the deputy director. Then again, the deputy director will write a mail to the project director. Then the project director again will write a letter to grant for permission to a committee for data. There is a data committee. The project director needs to write a letter again to the data committee. Only when the data committee agrees to share the required data, only then will be able to get it. So it takes a lot of time and it is very difficult. And finally, the quality of data that is being collected from data abstraction means that data we used to collect from the facility center is totally dependent on the quality of data of the source. For example, if data is being collected from IMS is often criticized for missing data and issues with data validity also. So these are some advantages and disadvantages of data abstraction. That's all from my side. So Pravinji, hello.
Yes, sir.
I can't see anyone raising their hands for any issue or any question. We have a lot of time we can discuss.
No, I think so. If anybody is having any question, they can unmute themselves or type in the chat box.
Is there any question or any clarification needed?
No, I don't think so because no one is raising their hand. So there are no questions.
Okay. So that's it from my side. So I think we have finished earlier, than the scheduled time.
Thank you, sir. Thank you.
Okay then. Thank you very much. Thank you, everyone.